I'll go ahead and get started. Hi, everyone. Welcome to today's Hospital Systems Addiction Care Community of Practice. Um, Thank you so much for joining us. I'm sure a lot of people know each other already on the call, but if you want to take a moment and introduce yourself in the chat, that's fine. We'd love to hear from you. Today's session is basically a series of healthcare updates, which seems appropriate for the month of June. We're going to talk about naloxone distribution, healthcare workforce, and hospital system process improvement program for comprehensive substance use care and support grant. Just a few housekeeping items here before we get started, just want to remind everyone that we are recording today's session. So if you can mute yourself, that's perfect, unless you're asking a question or part of a discussion. Next slide. And we definitely want everyone to participate. So sure, everyone's an expert in Zoom engagement at this point, post-COVID. It's been a while, but you can feel free to use the chat to ask questions or some of the reactions, as presenters are presenting. And you can raise your hand if you have a question, but feel free to participate and engage as we go. Next slide. So as a result of participating in this session, the participants will understand the new Board of Pharmacy rules that allows naloxone to be distributed directly from hospital emergency departments. They'll gain context around the initiatives to implement a comprehensive retooling of healthcare workforce in New Hampshire and gain awareness of new grant opportunities for hospitals that were approved by the Governor and Executive Council. Next slide. So I have the pleasure of introducing our three presenters, and I'm going to introduce everybody in the order that they'll be speaking. So first we'll start with Maureen Zenoy. She's the Senior Director of HealthForce New Hampshire and Foundation for Healthy Communities. And next we'll hear from Kathy, who I'm told I don't even need to pronounce Kathy's last name, but just choosing Kathy Bizarra Thunberg. She's the Executive Vice President from New Hampshire Hospital Association. And finally, we'll hear from Dan Andrus, the Director of Substance Use Disorder Treatment Projects for the Foundation for Healthy Communities. And with that, I'm going to turn it over to you, Maureen. Oh, I think you're muted.
Thank you. Thank you so much, Katie. I appreciate being here today. As Katie mentioned, my name is Maureen Zenoy. I'm the Senior Director for HealthForce New Hampshire, which is an initiative of the Foundation for Healthy Communities. Next slide, please. The mission for HealthForce New Hampshire is to promote innovative partnerships and cross-sector collaboration to grow, retain, and sustain a robust health care workforce in New Hampshire. At our core, HealthForce New Hampshire is founded on the belief that collaboration is essential to solving complex workforce challenges. And the healthcare workforce crisis affects every sectors from hospitals and primary care to behavioral health, long-term care, and community services. HealthForce New Hampshire works with stakeholders across the healthcare spectrum as well as across the state. So next slide, please. So HealthForce New Hampshire operates under what we're calling the 3 C's framework, and that is where we convene, we bring the right people to the table, we collaborate working across sectors towards shared solutions, and we communicate the efforts of the collaboration and solutions. So our goal is not to duplicate the work that others are doing, but really to convene the right people identify gaps, share successful models, and then help align resources to turn individual efforts into coordinated impact. Next slide, please. To develop a comprehensive approach to workforce challenges, back in 2022, stakeholders were brought together throughout the healthcare sector, higher education, community organizations, and through this collaborative process, the Giving Care Plan was created. And the Giving Care Plan is a strategic roadmap for expanding and supporting New Hampshire's healthcare workforce. It was updated back in 2024 to reflect the evolving needs and insights, and recently was reviewed again by the HealthForce New Hampshire Advisory Board. And I'm going to talk more about this in the future, a future slide. But while collaboration was essential to developing this plan and updating the plan, collaboration or equally critical is the plan for implementation and working together through partnerships across all stakeholders. Because where one of us succeeds, we all benefit, and sustainable solutions that we require that we continue working across healthcare sectors, regions, and organizations. So if we can go to the next slide, please. I mentioned the HealthForce Advisory Board, HealthForce New Hampshire Advisory Board. We have a very strong advisory board, and we meet every other month. Also an offshoot of HealthForce New Hampshire is a data committee, and this is the analytical background for HealthForce New Hampshire's strategic decision-making. It also provides information for our stakeholders. So our objective is to create one place where stakeholders can access data to answer key questions, and that help focus efforts on investments. Some of the things that we do are to review labor market data, to spot emerging trends, identify where data is missing and guide to help fill those gaps, translate complex data into clear insights for the advisory board as well as other stakeholders, and then track progress on strategic initiatives so we know what's working and what needs to change. So if we go to the next slide, please. This is just a graphic of the overall approach that the data committee looks at. So asking the questions, what, why, and what is the impact? Data availability by question. Is data available today? Are there limitations? Is this a data gap? What types of approach will be needed to fill the gap, quantitative or qualitative, secure resources, and then data synthesis and access. So currently, just to give you an example, the data committee is looking at research on healthcare burnout and retention. So not just why do people leave, why do they stay? So we're starting by looking at national data, and then the advisory committee will look at the results of that, how they apply to New Hampshire, and then how we'll move forward with that. So next slide, please. Another big project that HealthForce New Hampshire engages in is what's called the Innovation Challenge. And this is a statewide competition. We're in our third year, that invites innovators to develop solutions, workforce solutions, that are grounded in the strategies in the Giving Care Plan. So this is a spring competition, and there's a lot of funding at stake here. First place is $100,000, second place is $60,000, and third place is $40,000. So the next few slides, I'm just going to at a high level share with you the winners for the 2026 Innovation Challenge. So if we go to the next slide, please. First place winner is a project called Ahead. And you can see on the left, in the left-hand column, that these were the gaps that this group that Armand and Laurel identified in New Hampshire. And so I'll point you to the third bullet point where there's no structured pipeline that exists to guide high school students into allied health careers, such as LNA, MA, phlebotomy, or EMT. And this this focuses on the rural areas in New Hampshire. So while there are CTE schools throughout New Hampshire, not every community or every high school student has access to the programs in those schools. So their answer was to create a structured 3 to 6 month pathways that really takes rural high school students from exploration to certification to employment, and then provides mentorship along the way. So you can see in the italicized funding at the, or lettering at the bottom of the slide, this is how they'll be using their year one, the funding in year one, which will focus on building the program, looking at first cohort, and they're providing the funding. We'll look to provide the funding for the certification costs for the students in this project. So if we could go to the second slide, or the next slide, thank you. This is Work Health CoLab is the name of the project, and the problem that they solve is that, and there's some really interesting statistics on the left side, in terms of New Hampshire has the highest rate in US of workforce disability due to mental health conditions. And then disability costs are high for employers. But the last bullet point is really striking. If New Hampshire's work disability rate equaled the US average, the state would gain over 100,000 more workers. So if you tie this back to the mission of HealthForce New Hampshire, to build to increase the healthcare workforce in New Hampshire, the AHEAD program is working on pipeline. This is working on retention, and it's an evidence-based coordinated work health coaching program. Excuse me. And this funding specifically will be used to pilot a digital resource that they've invented, and use it with a healthcare employer partner to be able to scale workforce retention services statewide. So if we could go to the next slide, please. And then the third place winner is the peer program at APD. And this also is a retention initiative. And you can see the workforce is in crisis, the gap that they found, or the data that they found in their research, looking at how nurses are in crisis, first responders, and then also teachers and advocates. And so pretty high percentages there. And frontline workers are trained to care for others, but they push their own needs aside. And then even when support exists, there are significant barriers that remain. So what they found is in their research is that EAP programs are underutilized. Mental health services require individuals to self-identify, self-navigate, and wait for resources. And so while most program can treat the symptoms, not the trauma underlying the burnout and PTSD. So, and also they found that the culture of caring professions can stigmatize asking for help. So this is utilizing EMDR and equine therapies for people who have experienced trauma. And so they're going to be using their funding of $40,000 to actually expand. This is a current program, expand to community-based frontline workers like teachers or EMS, to help, again, to be able to scale this to statewide expansion. So these are the three programs this year. There's, in addition to this, the first year and second year also had three winners as well. And so right now I am working on developing a more extensive part of the HealthForce website, so that you can go there and look at all the winners, anything that resonates with you. You'll have contact information. As I mentioned, our networking is incredibly important. If you want to be involved, you'll know how to do that. So, and then if you go to the next page, or the next slide, please. I do want to highlight the HealthForce New Hampshire web page, and I believe these slides will go out to the community. Katie, did these go out? So these are active links. So you can click on this link and get to our website. But it's a really incredible website, and I take no credit in building it, but I see the value in it. It's where employers can direct potential employees to look at what is it like to live in New Hampshire? What are the resources? There's academic programs exist, or educational pathways for students who want, or people who want to go into the different healthcare professions. There's a financial support section, the workforce data and insight section. That's where the data committee will also put their findings up there. As I mentioned, what it's like to live in New Hampshire. So it's a resource for current workers, healthcare workers, for organizations that need to direct someone to look at what's available in the state. And then a lot of folks find us on their own and will reach out for different opportunities and connections. So, but if you go to the next slide, please. And this just wraps up my section. HealthForce is a very active social media presence. So I would encourage you to connect on Facebook, LinkedIn, and Instagram. I also put my contact information here, and my email and phone number. And the crux of my work is really built on building relationships. And that's really how I got started in the job. I'm coming up on my 1 year anniversary. And it's really been working with partners like you and the folks on this call that have really helped me understand the gaps and how I can help and how I can be a resource. So thank you very much for your time. And that concludes my presentation. I'm happy to take questions if there are any questions.
Thank you so much, Maureen. That was really interesting. I do have a quick question. It might give everyone else a chance to think if they have any. But can you just tell us the amounts of the awards again?
Sure. First place is $100,000,
Wow, okay.
and second place is 60,000, and third place is 40,000. And so that the advisory board did approve for the fourth annual Innovation Challenge Awards. And one of the changes that I'll be making in the next few months is to really get the information on the website early, so that when you go to the website, you'll see a tab at the top that says Innovation Challenge. So you can just get a sense for what it's like to apply, but you'll see more prominently the past winners, the past winners, as well as what you need to do to apply. One thing that you'll see this year that wasn't as available last year is that I'll be holding sessions to get people together across organizations and across sectors, because one organization might be so small but have a project and they can partner with someone else. And so
Mm,
that's allowable as well to do that.
hmm hmm Yeah, thank you so much for that.
You're welcome.
Is the money available to kind of just for program implementation, or like how, I guess,
Oh, you know, I actually,
and I can look this up, but
that's a great question. So, and it's not just program implementation. It could be on technology that saves costs, or makes, actually, I should say, makes the job more seamless, more, it allows someone to spend more time with patients, or
okay.
patient outcomes. It could be well, educational program. It could be retention. I'd love to see more programs in the retention field. One of the earliest surveys that HealthForce did was a financial needs assessment, and again conducted throughout the state. And that the findings on that was that a lot of the professional development funds will go to workers, healthcare workers who have certification tied to it. But one way to retain healthcare workers in any field, whether it's entry level or advanced, is to provide, whether it's leadership training or skill building. And so designing a program such as that. I do have a slide that outlines a graphic. I didn't include it, but I'm happy to send it to you. I can add it to the presentation because
Okay.
it really does outline 6 specific ways to generate ideas on how to think about the innovation challenge. But thinking about it earlier is better. It's not your typical grant application.
Hmm.
This is set up as as a pitch. As a business pitch, so that you're putting together a business plan. And then there are judges. I'm happy to say I'm not a judge. I support the judges because very difficult decision. Then the semifinalists are chosen and they deliver their pitch at the semifinals. And there are usually six semifinalists. And then from there, the finalist ceremony is held, and that's where the top three are announced.
Oh,
So it's
all
very
right.
exciting. And
Mm-hmm.
the
Mm-hmm.
feedback that we received this year, we held it at the St. Anselm School of Nursing, and they have a brand new building and they have a brand new sim lab. So they a beautiful facility, and it's really exciting to be in a place that's training future healthcare workers. But also they did tours of the facility. So we'll look to continue
Oh,
that
cool.
to tie that
Mm-hmm.
in. But whether you submit something or attend, it's a great way to learn. I think one thing I heard from our board, many board members who attended this year, that wow, the innovation that's out there is incredible. So I want to amplify that this year. So thank you for the
Yeah,
question.
of course. It's so inspiring. Thank you. Does anyone else have any questions for Maureen before I turn it over to Kathy? No hands raised. Nope, we're good. Okay, thanks
Thank
again
you.
for sharing. All right, I'm going to turn it over to Kathy. Take it away and talk about naloxone
Sure.
distribution.
Thanks, everyone. And it's hard to follow Maureen. She has some great content there, so I appreciate, what she brings to the table. So for me, just to back up a little bit, so the New Hampshire Hospital Association is a membership organization that represents all the hospitals in New Hampshire. We focus on advocacy issues, policy issues, and other activities that support what hospitals are trying to do, which is providing the best care possible to patients in the state. So, one of the things that I do in my role at the Hospital Association is I work with a variety of different professional peer groups. I work with the chief information officers or human resources or compliance officers. But one of the groups that I work with closely are the hospital pharmacy directors. And probably 2.5 years ago or so, and also in collaboration with Dan and Nancy at the foundation, it had been raised up that there were some barriers in hospital emergency departments from distributing naloxone to individuals who could benefit from that medication. One of the barriers is that it was unclear from the Board of Pharmacy's rulemaking that pharmacists, in collaboration with their ED providers, could freely distribute naloxone to patients and also remove patient names from any medications that are distributed. Medication prescribing and dispensing is highly regulated. And so pharmacists like to follow the rules and also for physicians as well, any healthcare professional, but pharmacists in particular really follow what the board of pharmacy says. So there really was no wiggle room for some of them to feel like they could work with their providers to reduce the stigma and create access to naloxone. So I work very closely with also the board of pharmacy and brought to their attention this situation and made a recommendation for rules change that would allow for this distribution of naloxone. And I'm going to put in the chat what the actual language is. And I am happy to say, after 2 years, Board of Pharmacy has been really backed up with their rulemaking, but I sort of brought it back to their attention. I'm like, don't forget this important issue. They did ultimately bring it back to their board. And as of June 1st, 2026, beginning of this month, they approved this statement in their institutional pharmacy rules. And what it says is drugs related to opioid overdose prevention, such as naloxone, may be dispensed for risk mitigation with an exemption from labeling requirements that identify the individual patient. So, in one sentence, we believe that it has increased access to patients and reduced stigma at the same time. So we are making sure that our hospital EDs are aware of this change. Hospital pharmacists are definitely aware of this change. And for any hospital ED that has been on the fence about being able to do this correctly and under, the purview of the Board of Pharmacy, now they have the permission to do that. Happy to answer any questions.
This is hot off the press.
Essentially, yes.
That's awesome. It's great work. Does anyone have any questions or want more information? Dan, did you
No,
have a
I was just
comment?
unmuting so that I would be unmuted when
Wait
my
till you're
presentation
ready.
started.
Yeah, okay.
But, afterwards, if you want to send this out, please, if anyone has any questions or has a question about their own hospital, we can put them in touch with the right individuals.
Great. Thanks so much.
Thank you.
All right, Dan. Dan's ready to go.
Dan is ready
And
to go, and I could not have had a more appropriate run-up to what I'm going to talk about. If you want to just flip forward to that first slide, we're going to talk about what is a new grant for the state. But let me give you some context about how this all came about. We are entering our 11th year in working with hospitals around the issue of caring for persons with substance use disorder. The world has changed and the foundation has changed, and the whole proposal process changed. This was a competitive request for proposal, and we found that out. And while it might seem less convenient, we said we are going to pour everything that we have into this proposal, knowing that we had a substantial competitive edge. We were not going to take that for granted, and we were going to give this all that we had. And I am greatly indebted to Nancy Fennell, who is joining us, and to Chris Herring, and to our executive director, Peter Ames. We worked for weeks on this and submitted it on March 20th and were awarded the grant for this year. So some of it looks the same and some of it looks different. In the past 10 years, we have worked with 21 of the 26 acute care hospitals in the state, had all told more than 50 different projects, and have been working steadily and have, I think, significantly moved the needle in terms of substance use care for people. You have gotten a taste of what the association and foundation are like. This is an incredible organization. It has an absolutely enormous amount of expertise. Kathy, I believe, is celebrating 41 years with the organization this month and is well versed in an entire spectrum of policy issues relating to healthcare. Nancy Fennell, who has been partnered with me in this project formally for part of the last year, and informally since my first day on the job in March of 2020, has contributed to this. And I need to mention now something that is just giving us great joy, but Nancy will be honored this evening at NAMI, New Hampshire's annual meeting as the Systems Transformation Leader of the Year. So what I want you to do is just have a sense, and you've seen it from Maureen, and we are moving into new areas in terms of the HealthForce. We are moving to new areas in terms of the Rural Health Transformation Grant. And our established programs are growing in ways that continue to bring the best and brightest to New Hampshire hospitals. My colleague and friend, Rory Dawes-Diamond, who is our Senior Director for Rural Health Care, Beth Wheeler, others. Rory has brought to us a new initiative called Team Birth. And it is a cohort model where hospitals are working together to improve care and outcomes around the birthing process. And that's worth an hour in of itself. But there's so much happening here at the foundation, so much of the work that Nancy has done over the last several years. We just poured everything into it. So we did get the new contract, and it is very typical of the contracts we have had before. I'll touch very briefly on what's the same. So it's a 1-year grant with a possibility of renewal for up to an additional 2 years. We are again recruiting for 6 hospitals to work across all areas of patient care. EDs, acute care units, networked outpatient practices to improve SUD. And if we can move to the next slide, the focus remains as it has in the past, that there will be 2 primary process improvement projects and 3 secondary that are sort of like a choice of a menu. And we will, and yes, thank you, Jen. Way to go, Nancy. We are celebrating today. This is a day of celebration and joy at the foundation, not only for Nancy's award, but the fact that she was able to join us in person on Tuesday. And next slide, please. The foundation of all of the substance use care is you can't treat it if you don't know that the patient has it. So again, we are emphasizing screening and brief interventions. Those 2 simple kind of initial processes are what starts all of this, and the entire infrastructure of substance use care is based on that. Next slide, please. Along with that, hospitals will choose who to participate in this with a pick of 3 or more items from this particular list. So the folks who are pursuing this will have some ability to either build upon existing strengths or to identify areas where they can make some substantial progress. Next slide, please. Responsibilities remain very much aligned as they have in the past, but there are some changes. Hospitals appoint a project coordinator, and this year we are emphasizing more than ever an implementation team. Some hospitals have very robust teams. In other places, there is just simply one person who does all of this. One of the emphases we would like to drive home this year is having competence around the quality improvement methodology. We will provide training. We have a vice president of quality and safety. This is the quality and safety arm of the New Hampshire Hospital Association, and there are some models that we hope to see being actuated in real time, but just the really solid basis of using proven methodology around quality improvement to improve substance use care. Data collection. These community practice meetings will continue, but they will be retooled somewhat to make this more of a place where there are more voices. Much like today, you're hearing from 3 voices from the Foundation for Healthy Communities. This is a place where hospitals are regularly reporting to each other and to the larger community of hospitals what is happening in their places. We see powerful results when people come together around a common problem. And it's our hope that this community of practice really lives into its full potential for being a ground and a place and a space where that kind of information is exchanged and innovation is encouraged and people support each other with that. The other part of this is the lovely quarterly reports that people are getting yesterday and today from me that are due 3 or 4 times a year. And that will again be modified to really focus on data metrics, really focus on the process, and really saying if you're not getting the results, what kinds of questions do you need to ask? What kinds of processes do you need to engage? What stakeholders need to be in the table? And what kinds of elements of the quality improvement process do you need to bear on this? And finally, there is a big effort on sustainability. We are doing this for 1 year for this grant period and have no sense that hospitals will make quantum leaps in abilities. But what will it be that both maintains the progress they've made and allows them a basis in which to make future progress? So we'll be talking a lot about sustainability planning, which has always been a part of this implicitly, but we're going to be much more frank about having it out front and asking the hospitals to reflect within their own organizations and with other organizations about how this becomes embedded and how best we can sustain it in the face of some truly challenging times around funding and other environmental context factors. Next. So after tomorrow, I'll be going on vacation, and for that, I'll have some documents that I'll be entrusting to Chris and Nancy to And our director of communications will also be away. And when I return on July 6th, we hope to, on that date or very shortly thereafter, open applications, leave those open for 3 weeks, and use that time to market this program, to talk with people, to answer their questions, to encourage their applications, and then to use the final week of July to take a look and to make some final selections. We committed in our proposal, and we commit here to you today and ongoing, to be fully transparent in that, so that hospitals are aware of what criteria are being used and that there's no mystery to this. After that, we dive into the deep work of subcontracting, setting performance targets, and the detail work. And then pretty much from September forward, we are off and running for the remaining months of the fiscal year to at least start the cycle of quality improvement and to begin to build a start that we hope will be continued in subsequent years. Nancy, you and I have talked for hours about how this, and because you are a systems transformation leader, did I leave anything out of this already too long conversation?
Thank you, Dan. No, the hospitals need to be aware that this takes commitment and that there is work that needs to be done with it, but integrating it into their regular everyday operations is really what's a key issue of it, because that will influence the sustainability of this type of programming. Knowing that you are there as a resource, being able to learn from the other hospitals is a real valuable aspect of this program, and also learning what others are doing, innovative work, and using Maureen's words, that innovation challenges. This is sharing this information with your hospitals that you know of. And already, Dan, I'm thinking of a few hospitals that are working on things that could probably really benefit from this type of funding to keep their innovative programs running. So I'm hoping that you will all share this with the hospitals that you work with to let them know about it. And the ability to work with someone who's not a project coordinator at CMS, not that there's a bad thing about CMS and project coordinators, but Dan is much more of a person who's there when you need them. So working from a
and sometimes when you don't.
yeah, and working from a local community perspective and knowing what New Hampshire is all about is very beneficial in this type of work. So really take a look at the grant application. Please share it with your colleagues in your hospitals, and I hope that many of you will help others take advantage of it.
Thank you. Perfectly said, as I expected. And Nancy is fond of calling people out during her behavioral health clinical learning collaboratives. It keeps you on your toes, and I had no qualms about doing that to her. She would never disappoint. So this is how to reach me. I think everyone knows how to reach me. I'll be away for a few days, but back right after the long weekend and here for the duration. I think that brings me to the end of my presentation. Are there any questions? Great. If there are, you can reach me at that. So we're ready to, I think, Katie and Kai to move into our final slides.
Yeah, we'll close it out here. Thank you so much, Dan and Nancy. If I had to choose a word to describe today's community of practice, I think I would choose the word opportunity. It seemed to sort of be a theme throughout all of the presentations, and it was very welcome. These are very welcome updates in times that can be, that are hard these days often. So I appreciate your presentations, all of the good news and exciting opportunities that you shared. Nancy did mention definitely sharing this information out. And I want to remind everyone that you can find the recording of this session as well as the slides on our website, nhtac.org. It'll take us a day or two maybe to get that up there, but it'll be out there. And so please share away. And that's how we'll get the word out. I want to again thank the presenters and the Department of Health and Human Services, the Foundation for Healthy Communities, for bringing us this community of practice. And I think, as Dan said, we're here for the long run. So this is the last one in this state fiscal year, but we'll be moving on and offering more sessions next year. And hopefully you can all join us and tell your friends to join us too. That would be great. I'm going to go ahead and move us along to the final slide, which just is a link to the evaluation. Kai, could you throw the SurveyMonkey link into the chat for everyone in case it's easier to access that way? So here's the QR code. And the link to the evaluation. We do offer one CEU. I'm trying to talk to get us to 12:45. So I feel like we can offer one CEU. I'm just kidding. But no, we do offer one CEU for participating. You do have to stay for the whole session and complete the evaluation. And even if you are not interested in the CE, we'd love your feedback about today's session and what you'd like to hear about in the future too. So again, I hope everyone is having a wonderful start to the summer. Oh, Chrissy, question.
Hi, everyone. Welcome.
Hi.
Congratulations, Nancy. I'll be at the NAMI Awards as a colleague of mine is receiving an award too. So I will cheer you on tonight. I just have a question, and I might have missed it. Is the grant open to all New Hampshire hospitals?
Yes.
Okay, so
Yes.
like Maine Health goes up into Maine, and I know they do like Carroll County up. So would they
Yes.
be considered? Okay, thanks.
We are one of the things that's changed the last 10 years is the degree to which so many more of our hospitals are affiliated with larger systems, which brings some challenges and often a tremendous amount of benefits and access to resources. So, but we still work anybody within the borders of New Hampshire, and we have had some really terrific working relationships with the organization that you identified. And the folks in Maine have been instrumental as we worked through the MOUD and the ED initiative in providing advice and some very strong counsel about how to go about doing this. And no surprise, a lot of the resources we have on our website came out of those systems and from Maine and from California. So, but yeah, the simple answer is, yep, you're a New Hampshire hospital, you're in.
Excellent. Thank you. We work, so I'm the assistant director at a recovery friendly workplace, and we work with a number of New Hampshire hospitals, but we find that their engagement can be difficult because of turnover, and we have different contacts and things. But we've been working just recently with Maine Health, so I was just curious if we could do anything to help kind of share out this information and help to get people on board. So we are happy and willing to do whatever we can to support this.
Yeah, we are well acquainted. We are currently engaged with 4 hospitals in a hospital system. And we have seen roughly in the 2 years of that engagement about a 50% turnover in the people who are project coordinators. So it's this sort of continual cycle, which in a way, the more people that we expose and engage is a good thing for us in the long run. In the short run, it's a little bit of extra work getting people on board, but we're pretty
What a great
friendly.
opportunity, though. That's
Yes.
wonderful.
Yeah.
Thank you.
Thanks, Christy, Christy, for asking a question. Are there any other questions? I should have asked that.
Well, Katie, I think it's
Okay.
great to see folks, and we'll wish you a happy summer, and we'll be back in August.
Sounds good. And the survey link is in the chat. So we'll close out for today. Take care, everyone.